Dear friends, there are coughs that just won't stop. I've taken cough medicine, throat spray, and antibiotics, but I still have a cough. Cough at night, cough when lying down, sore throat, phlegm that cannot be coughed up. But when I went back to the doctor, there was no infection. Strange, right? Perhaps the root is not in the throat, but in the spleen and stomach, in the liver key, and is due to gastric reflux. In this video, Dr. Green will share a safe and effective Oriental medicine method to help people stop reflux cough from the root. No need for throat spray. No drug dependency, but still reduces cough, helps sleep, lightens stomach, soothes throat. Sit down, make a warm pot of tea, and listen. Maybe you don't need to treat your throat. Just calm your stomach, cool your liver, and the cough will disappear on its own. Part 1. People have a cough that won't go away because of wrong treatment. Dear Dr. Green, nowadays, who hasn't coughed? Some people cough for a few days and then get better, but some people cough for months on end, until their voice is hoarse, their throat is sore as if it's been scratched. They can't sleep at night and can't talk in the morning. They go to the doctor and they say it's pharyngitis. They take antibiotics, throat spray, and suck on mints, but it still doesn't get better. The more they cough, the drier and more tired they become. I have met so many people like that. Once, an aunt and uncle came to see me and told me, "Doctor, I have been coughing for more than 2 months now. Every night I have to prop up an extra pillow and lie on my side to breathe easier. But after eating, my throat feels hot, and I cough like I am choking, and I can't cough up any phlegm. I have taken countless doses of antibiotics, but it doesn't seem to help." Hearing that, I knew right away the root of the disease is not in the throat as people think, but in the abdomen, in a place that seems unrelated, the stomach. This disease is called gastroesophageal reflux cough. It sounds strange, but in fact, this disease is very common, especially for people who eat irregularly, are stressed, have insomnia, drink alcohol, coffee, or eat a lot of greasy food. Yet many people keep gargling, spraying their throats, and taking antibiotics continuously, while the real fire is burning from below, not from the throat. I call this the treatment of symptoms but not the root cause. Dear friends, the throat is just the end of a chain reaction. When the stomach is irritated, when acid refluxes, it heats up the esophagus. It goes through the throat and causes irritation. The throat is just the bearer, but if we only focus on throat sprays or cough drops, it is like using an umbrella to block the rain while the storm is raging from within. I often tell people who come to see me this way, a cough caused by a sore throat can be treated with throat spray and anti-inflammatory drugs. But if you want to cure a cough caused by reflux, you have to reconcile your stomach first. Therefore, correct diagnosis is of utmost importance. Both are coughs, but the root causes are completely different. If you cannot differentiate, even the best medicine will be useless, and you will waste money, effort, and become more tired. I hope that after this video our people will have a different perspective. Don't be so quick to blame the throat. Don't force it to take responsibility forever. Take a deep look at your spleen, stomach, emotions, sleep, and daily diet to see the big picture. In the following sections I will help you clearly distinguish between coughs caused by reflux and coughs caused by so you know how to treat the root cause. So you don't have to cough forever, have a burning sensation forever, and lose your voice forever. If you see yourself in this story, don't be sad. The reason I corrected it wrong before was because I didn't know. Now that I know, let's correct it together. Slowly, but correctly. And I, Dr. Green, will always accompany you on your journey to regain your calm breathing, peaceful sleep, and a body that no longer has to cough another day. In the following sections, I will help you clearly distinguish between coughs caused by reflux and coughs caused by pharyngitis, so you know how to treat the root cause, so you don't have to cough forever, have a burning sensation forever, and lose your voice forever. If you see yourself in this story, don't be sad. The reason I corrected it wrong before was because I didn't know. Now that I know, let's correct it together, slowly, but correctly. And I, Dr. Green, will always accompany you on your journey to regain your calm breathing, peaceful sleep, and a body that no longer has to cough another day. Part 2, same cough, but one in the throat, one in the stomach, dear Dr. Green. Today, I want to delve into something that seems very simple, cough. But the more I examine and talk, the more I realize cough is not simple at all. Because some people cough because of sore throat, some people cough because of pneumonia, some people cough because of stomach. Sounds strange, but that's the reality I see every day in the clinic. When we have a cough, we think of the throat, but the truth is, not all coughs originate in the throat. There are cases where, after asking about the patient's condition, I immediately know that the cough is caused by gastroesophageal reflux, not by infection or a cold as many people think. Please note, reflux coughs often appear at night, when you lie down to rest, or after a full meal. Some people have to prop up a pillow or sleep sitting up, because every time they lie down, acid refluxes, their throat is hot and itchy, and when they cough, there is no phlegm, but the feeling of obstruction does not go away. Not only that, people often suffer from belching, heartburn, bitter mouth, bad breath, bloating. Many people also have trouble sleeping, prolonged stress. The more tired they are, the more they cough. A very unpleasant, vicious cycle. The thing is, no matter how much antibiotics or throat spray you take, it doesn't work. The more you use it, the more dry your throat becomes. Your voice becomes more and more sore, and you lose your voice and feel exhausted. Why? Because you're treating the wrong place. In contrast, coughs caused by sore throats or respiratory tract infections have very different symptoms. Usually, people will cough a lot in the morning, when it is cold, or when the weather changes. The throat will feel sore, accompanied by a runny nose, stuffy nose, sore throat, and mild fever. The voice will also be hoarse, dry, and sore when talking a lot. There may be a cough with yellow phlegm, or a dry cough, but just need to rest, keep warm, and treat inflammation properly to recover quickly after a few days. In particular, this type of cough does not cause belching, heartburn, or chest burning, and usually responds well to common cough medicines, throat sprays, antibiotics. Dear friends, both are coughs, but one is caused by acid from the stomach irritating the throat, while the other is caused by viruses and bacteria attacking the throat and bronchi. Coughs caused by reflux are in the throat, and the root of the disease lies in the lower abdomen, in the spleen and stomach liver key. Coughs caused by infection are in the respiratory area, and can be treated directly on the spot. If people cannot differentiate, but just hear a cough and spray their throats and take medicine, it is like seeing water leaking out of the roof and retile it, while the hole is under the foundation. To send a sincere message, understanding the root cause of a disease is the first step to treating it correctly. No one wants to live with a persistent cough, restless sleep at night, and difficulty speaking during the day. And no one wants to take antibiotics forever, or use throat spray continuously without getting better. So, everyone, please listen to your body. Don't just listen to the cough. Observe all the accompanying signs. When you cough, how your throat feels, whether your stomach is uncomfortable, whether your mouth is sour or bitter. In part 3, I will explain more. Why does reflux cause cough? How can spleen and stomach liver key be disturbed to cause a sore throat that won't go away? And most importantly, how can we treat the root cause so that the cough disappears as gently as morning dew? Dear Dr. Grain, we have learned together how to distinguish between coughs caused by reflux and coughs caused by and today I want to go deeper, so that our people can understand clearly. Why can the stomach make us cough forever? Why do all the throat medicines not work? It sounds strange, but it actually makes sense if we understand how our bodies work. Weak spleen and stomach root cause. First of all, in Oriental medicine, the stomach and spleen are collectively called the spleen and stomach, the place that receives and digests food, and at the same time creates blood and key to nourish the whole body. When the spleen and stomach are weak, meaning the digestive system is not functioning properly, it is easy to cause phlegm, stagnant key, bloating, heartburn, and the stomach is like a pot. If the fire is weak, the pot will not boil and the food will not be done. Food stagnates, creating gas and phlegm. That phlegm not only stays in the stomach, but also follows the opposing key, rising up to the throat, causing a feeling of obstruction, unable to cough up, and a persistent cough. Liver key stagnation. Rebellious key causes throat irritation. Next, the liver not only detoxifies, but also regulates emotions and blood. When people are stressed, anxious, or angry, the liver key is easily stagnant, causing the key to not flow in the right direction. Instead of going down as usual, it rises up, causing gastric juice to flow back up. Irritating the throat gives coughing. Many people clearly see that every time they are stressed, sad, or worried, their cough increases and their throat becomes more sore. This is a clear sign that the liver key is going against the flow, affecting the stomach key and causing a cough. Low heat stagnation. Gastric reflux. Another factor is long-term heat accumulation, which means toxins, fats, oils, and undigested food accumulate in the body for a long time, creating a hot and humid environment inside, damaging the stomach lining, increasing acid secretion, leading to frequent gastric reflux. At this point, the throat is not the place where the disease breaks out, but only the place where it suffers. The throat is inherently fragile and vulnerable when it is burned by acid reflux every day. It becomes sensitive, dry, and inflamed for a long time. People keep coughing, spitting, and taking medicine but not getting better, because the root of the disease has not been treated. Why does treating cough in the wrong direction make the disease worse? When people have a cough, they habitually look for cough medicine, throat spray, antibiotics, mint candy, etc. These things can temporarily relieve symptoms, but if used for a long time without treating the reflux, it is like cutting off the top while the root is still alive. The more antibiotics you use, the drier your throat lining becomes, the more beneficial bacteria in your throat are destroyed, making your throat weaker, thinner, and more susceptible to irritation. As a result, the longer your cough lasts, the more your health deteriorates. To stop coughing, you have to start from the root: spleen, liver, lungs. I always tell my patients, the throat is just the end of a river. If the water source is polluted at the beginning, it cannot be filtered only at the end. Therefore, to treat it correctly, you must nourish the spleen and stomach, help digestion better, and avoid phlegm and dampness. Must relieve liver key stagnation, make blood circulation, stomach key go in the right direction. Then comes moistening the lungs, soothing the throat lining, and repairing damage caused by acid. Only when the spleen is strong, the liver is open, and the lungs are calm, will the cough truly subside and the throat be restored to peace. Dr. Green would like to reiterate once again, coughs aren't always a throat problem. Listen to your gut, your emotions, your diet, your lifestyle to see that the body is a tightly connected system where a small problem can cause symptoms far away. In part 4, I will give more specific instructions: how to cure cough caused by reflux, how to combine medicine and lifestyle to strengthen the spleen, relieve liver problems, and moisten the lungs naturally, effectively, and safely. Dr. Green greets everyone. By this point, you probably understand that a persistent, long-lasting cough that cannot be coughed up. Oftentimes it is not due to a problem with the throat, but due to reverse gas rising from the lower abdomen, which is gastroesophageal reflux. I have a principle, a piece of advice that I always tell my patients, which is, if you want to cure a cough from the root, you have to treat it from the stomach up, not from the throat down. Cough treatment cannot be based on just a few lozenges or a throat spray, but must go from the spleen and stomach, liver key, then to the lungs. So what exactly must be done? 1. Strengthens the spleen and stomach, strengthens the digestive system, prevents phlegm and dampness. The spleen and stomach are the foundation for the body to digest and convert food into blood and energy. If the spleen and stomach are weak, phlegm will be produced, and this phlegm will not only stay in the abdomen, it will go up to the throat, causing obstruction and coughing. So the first thing is to make your stomach healthy again. Eat on time, enough meals. Absolutely do not eat too late. Avoid fried spicy foods, alcohol, and coffee because they damage the spleen and stomach. You should eat brown rice porridge, warm water, and light vegetable soup to help with digestion and nourish the spleen. Regarding herbs, I often use ingredients such as Chinese yam kwa, tangerine peel, and licorice to strengthen the spleen and regulate the stomach. 2. Sokan jiayuat cools the liver so that the qi no longer reverses. The liver greatly influences the digestive system and emotions. People who are often worried, angry, and have trouble sleeping are very susceptible to liver qi stagnation. Poor circulation, then it rises back up, creating reflux, making the throat burn and causing coughing. To solve this part, we need regulate emotions, learn to breathe deeply, take a light walk, listen to meditation music, reduce stress, drink herbal teas to cool the liver, such as artichoke tea, chrysanthemum tea, lotus heart tea. Use liver-relieving herbs such as Cyperus rotundis and Cuculago orchioids to help the liver circulate and relieve stagnation. When the liver is relieved, the blood and qi will flow smoothly, no longer reverse, and the cough caused by reflux will be significantly relieved. 3. Nourishing yin, lubricating the lungs, soothes the throat, restores the mucous membranes. Finally, after treating the root cause of the spleen and liver, we should take care of the throat, which is damaged by acid reflux every day. At this step, I usually guide you. Drink warm water mixed with honey and thinly sliced ginger to help soothe the throat lining. Suck on licorice, mint fritillary, cool, moisten the lungs. Use additional ingredients such as Chinese clematis, Aphiapugan japonicus, Lydian mulberry leaves to help nourish yin and restore damage to the throat area, which has been burned for many days by acid. Remember, when the mucosa is restored, the cough will really stop. Combine rhythmically, only then will it be finished. I often compare treating cough caused by reflux to replanting a withered garden. Must fertilize the roots, loosen the soil, then water the leaves. If people only care about spraying moisture on the leaves, but forget about the withered and rotten roots, will the tree still be fresh? Therefore, to really get rid of cough, people need to eat right, mood regulation, take medicine or use herbs according to the principle of strengthening the spleen, clearing the liver, moistening the lungs, and most importantly, be patient. Don't rush into recovery after a few days. Dr. Green would like to say it again. Your cough is the voice of your body, calling for help from within. Listen and treat it properly, then your throat will stop hurting, your voice will stop being hoarse, your sleep will be peaceful again, and your life will return to normal. Dear Dr. Green, we have gone through a long journey together, from distinguishing types of cough, understanding the root cause of reflux cough, to the right treatment method by strengthening the spleen, clearing the liver, moistening the lungs. Today I would like to send you some small tips and simple yet effective ways to help treat coughs caused by reflux right at home, without the need for Western medicine, inexpensive, yet still safe and benign. 1. Eat on time, right amount, right way. The stomach is like a pot. If we put coal in at the wrong time and in the wrong way, it will only cause smoke and choking. and will not cook the food, but will also produce toxic gases. Coughing due to reflux is the same. Eating and drinking indiscriminately is adding fuel to the fire. People should remember 3 core things. Don't eat too much, especially at night. Eat just enough. Stop when you feel slightly full. Don't wait until your stomach is bloated. Do not eat late after 7 p.m. Especially do not lie down immediately after eating. After dinner, you should sit up straight and walk slowly for about 15 to 20 minutes. Divide your meals into smaller portions. If you have a weak stomach, 4 to 5 small meals a day instead of 3 large meals. Should prioritize dishes: brown rice porridge, spinach soup, steamed tofu, lotus root, pumpkin, and bland squash. Drink warm water regularly. Avoid ice water, carbonated water, coffee. 2. I often advise people to cook light, cool water that is soothing to the liver and throat. Helps soothe the stomach and effectively reduces reflux. Chrysanthemum tea plus licorice soothes the liver, clears the lungs, and gently reduces cough. Fresh ginger juice plus honey warms the spleen and stomach, disinfects the throat, reduces burning sensation. Sour star fruit leaf juice or lightly cooked fish mint cools the liver, aids digestion, reduces belching. You only need 1 to 2 warm cups a day. Drink small sips. Don't drink cold or rush. 3. Adjust your lifestyle. Good sleep is the best medicine. Stress is an accomplice in causing liver key stagnation, and rebellious key causes coughing. People need turn off your phone and TV before 9 p.m. Create a quiet space for easy sleep. If you have trouble sleeping, you can soak your feet in warm water with ginger and salt to help calm your nerves and help you fall asleep. Avoid lying too low. Use a moderately high pillow to prevent gastric juice from refluxing while sleeping. Just a deep sleep, the body begins to recover. The better you sleep, the less coughing. 4. Practice abdominal breathing. Bring the air in the right direction. A great way to regulate the air in your body is to breathe with your belly. Sit still, relax your shoulders, and place your hands on your stomach. Inhale slowly, allowing your belly to expand, not your chest. Exhale slowly, deeply, and feel your belly fall. Just 5 to 10 minutes of abdominal breathing every day will help you feel more at peace, your stomach lighter, and your throat less tense. 5. Some folk tips to soothe the throat and calm the lungs. Suck on a small slice of fresh ginger. Helps disinfect and soothe the throat. Licorice softens the throat and clears the lungs. Steamed pear with rock sugar and chia seeds cools the throat and nourishes the lungs. Use steamed garlic with honey. Mild antibacterial, anti-inflammatory, reduces cough at night. Note, these tips are only supportive, not a substitute for the root cause. But when combined with strengthening the spleen, soothing the liver, moistening the lungs, the effect is doubled. Final words from Dr. Green. Curing a cough is not just about silencing the cough. It is about getting the body back to normal, digesting well, sleeping well, and not feeling like the throat is a burden every day. Please be patient. Don't rush. The body needs time to recover, especially with diseases originating from the air, the liver, or the stomach.